International Day of the Girl Child on Monday, 11th October 2021, we want to draw attention to one of the most widespread ailments experienced by girls and women the world over, PCOS, or polycystic ovarian syndrome. Worldwide, it affects 6 to 10% of all women, making it the most common endocrine disorder in women of childbearing age. So to help us learn about what it is, how to manage it, we have a panel of experienced doctors with us today who will address the questions you asked us while registering and any others you may ask us as we go along. Okay. So what exactly is PCOS? Polycystic ovarian syndrome, PCOS, is actually not a single disease, but it has multiple clinical symptoms and a range of underlying causes. And that is why it's called a syndrome. It affects not only women of childbearing age, but even adolescents and postmenopausal women too. So, the general question is PCOS a disease of the ovaries and cysts, as the name suggests? No, it is not. It's an endocrine and metabolic disorder that affects the body well beyond the ovaries. And this is something we will discuss in detail today. So although the real causes of PCOS remains unknown, and it may even have genetic linkages in some cases, it has been actually clearly linked to insulin resistance and obesity. Now, what is that? The presence of PCOS makes it more difficult for the body to use the hormone insulin, which normally helps us convert sugars from food that we eat into energy. So this condition actually is called insulin resistance. And what it does is it causes insulin and sugar or glucose in our body to rise in our bloodstream. And you know that excess sugar in blood means what? Excess fat deposits, especially around the tummy area. And insulin rise also helps, regulate. Actually, insulin helps regulate ovarian function. So ovaries respond to increased insulin by producing excess of male hormones, causing imbalance in other hormones, leading to several other changes, which our expert panel will tell us about. And, research shows that PCOS is very common in India, ranging widely across the country from 26% women affected in East India to up to 9% in South India. So clearly, it's not something we can ignore. So let's learn more about this from our expert. So I'm delighted to welcome and introduce to you our first panelist for today, Dr. Dheeraj Bhatia. Dr. Dheeraj Bhatia has over 35 years of clinical consultancy practice in New Delhi and has been a senior consultant cardiologist with Escorts Heart Institute and Max Super Specialty Delhi. In fact, he has been the senior medical advisor to VLCC for last 20 years. Good morning, Dr. Bhatia, and welcome to the webinar. And thank you so much for joining us today.
Good morning, Dr. Anju, and very good morning and namaskar to all the guests who've taken time out to join us. It's indeed a pleasure to be continuing with our 15th very important date, which we pick up is 15th of every month, where we share and knowledge empowerment for all our guests. And it's really heartening to see that so many people come online, and because they want to know about various illnesses and various conditions which we discuss, on the 15th of every month. Now, I think to set the ball rolling, Dr. Anju, I think you're getting a list of questions. Would you like to?
Absolutely, we are getting a lot of questions. So let me start with the first question uppermost in the minds of everyone attending today. So what exactly are the signs and symptoms of PCOS, Dr. Bhatia?
Right. So to understand the signs and symptoms, there are a couple of very important comments. Number one is that, you have to understand what is happening in the female body, that this condition, PCOS, comes up, which is a complex of symptoms, you know. So that is one thing to understand. Second thing I must say that PCOS is quite a common condition and it is missed very often. It's missed by the best of doctors. And the reason it is missed as we go along, I should just narrate those because there is a certain kind of criteria which has now lately been suggested by the WHO and various endocrinological societies from the US to Europe and our own Indian society. So those criteria are important to understand, and that I'm going to put it very simply so that all of us here, the guests, even who don't have technical knowledge, can really fathom out what's happening. So basically, the two things. One is like Dr. Anju mentioned, the male hormone starts dominating, which is androgens and your testosterone. Now, when the male hormone starts dominating, what's going to happen is there are going to be masculizing features. So you will find acne coming up, right? Then you will find hirsutism, and you will find thinning of hair. Now, each of these, there is something. Like an acne is not the usual acne. You will have a lady walks into my clinic chamber who's 30, 35, and she says, I'm way past the age for pimples. And why am I getting? So you'll see the acne, there's a difference. There will be scarring, there will be a multitude, they are long drawn for a number of years. So, and she's just been applying ointments which you get across the shelf from the chemist. And very often, unfortunately, in our country, the chemist says, "Nahi, madam, ye laga do." So she's busy rubbing that, and years are lost. So that's why I was saying these things are missed. So that is one. Second, the hirsutism, which is excessive facial hair, that is a little coarse variety. It's not like a simple, which, very often you'll have ladies having a slight bit of soft hair on the face. That's fine. But this is a little coarser and darker. So it can be on the face and it can come up on the chest, on the tummy. But this kind of hair, the texture is different. So it's important to recognize this. Thirdly, they start having hair loss. And the hair loss so it's very interesting. You have excessive hair all over the body, but where you should have it, you start losing hair. So there, when they sit in front of us, one thing which you notice is that there is male pattern baldness. And they will be thinning right here, right here. They will be thinning. And as that progresses, if it's missed, then they will be thinning at these 2 points, which we call male pattern baldness. Now, again, if your androgens are high, what's going to happen? Your menstrual cycle is going to go haywire. It's also going to go irregular because of the insulin, which we'll just come to. So there are other reasons as well, but most of the time, they can be very... Now, the menstrual history is very important. It could vary from delayed puberty, menarche, it can go to delayed, or you can have suddenly post-menopausal bleeding coming up. But most important is they have something called oligomenorrhea. Oligomenorrhea means less. Oligo stands for less bleeding. So less bleeding during the menses. And they can also have amenorrhea, absolutely no bleeding. That can also present. So that's very worrying for a lady because, for her, the skin, the hair, and the menstrual are very important. And all three, are all part of the same gamut. And they get depressed because they say that you've got different diseases, but not realizing it's the same thing. The other part is the insulin starts rising. Actually, now, in the last few years, we've understood that all this is happening mostly. There are many theories why it happens. There's no clear-cut answer. There's genetic, there's environment. People will throw the net will throw a lot of multitude of jargon to you. But basically, it is high insulin, which they found, which is common to all conditions. The insulin starts going up. Now, what tilts the balance is if you start getting central obesity, if you start getting a tummy. Now, when that starts happening, your insulin receptors get blocked, which we call insulin resistance. Response to that insulin resistance is body pancreas releases more and more insulin to open the receptors. Simply. So basically, just remember, you will have high insulin, and because of that, there will be problems. And high insulin usually causes fatigue. Number one history which you should take is fatigue. They will start saying that we feel tired. And at the same time, we know in PCOS, exercise. So we tell them exercise, they can't exercise because they're fatigued. So unless you correct that, there's going to be a problem. So number one is fatigue. Number two, high insulin. Insulin is called a lipogenic hormone. Lipogenic, which means it makes fat. So if your insulin is high, your glycogen will convert into fat like that. So you'll give a history that I hardly eat anything and I gain weight. Isn't it so? Or you will say, I'm trying my best, but I'm not losing weight. Now, this is all because of insulin. And you land up with a tummy. Usually in females, more than 80 centimeters is central obesity. More than 80 centimeters in females is central obesity. In males, it is more than 90 centimeters. You see, the difference between the US and European Western counterpart and us is this. They have overall obesity. We have central obesity. You land in India, you see the porter, you see the customs officer, you see the cops, everybody's tummy is out. Now that is an indication of high insulin, the number one indication. So these symptoms are the major symptoms which we look at.
Thank you so much, Dr. Bhatia, for this clarity. So if you're finding it difficult to lose weight, you're fighting central obesity, stubborn acne, and premature hair loss from the scalp, or perhaps some hair growth on the face or upper body, and also, dark velvety patches on the skin, particularly on the neck, underarms, or groin, please consult your doctor for possible PCOS, right? So there is a lot of confusion regarding the diagnosis of PCOS. And so the related question from the audience for you, Dr. Bhatia, is clinically, how is PCOS diagnosed? Is there an established criteria? Like you said, this criteria.
Right.
So we would like to know about
this. This is a very important question. This is when I started my talk, I was trying to explain. It is missed very often for this reason. Now I'll give you the reason. So there are basically three modalities you look at. You look at the clinical profile, which I've given you all the symptoms, and you look at some certain signs, like you have the darkening of the skin here, which you call acanthosis, or you have biochemical, which means blood tests, biochemical parameters. And thirdly, the third modality is your ultrasound. Now, it's interesting to note that you may not have all the symptoms. You may have only one or two symptoms, right? Or you may have no symptoms. Can you imagine? You will have no symptoms. Then how do you figure it out? Sometimes a lady suddenly says, I've got very severe abdomen pain. And she lands up in the emergency. And the doctor says, the GP says, this is an appendicitis. But when you go for an ultrasound, what do you find? You find hemorrhage in one of the cysts. Or you find the cyst has twisted. Or you just find simply that there are many follicles there. So there's a certain criteria to diagnose that. So very often you pick it up on ultrasound. You will have no symptoms. Very often the ultrasound, a patient comes to me in my chamber and she says, doctor, I've got this fatigue and, I'm getting certain pimples and I'm getting a little hair. So I tell her, I think it's PCOS. She says, no, doctor, this is not PCOS. I said, how are you so sure? She says, because I've had an ultrasound, which is normal. So you see, very often the ultrasound doesn't give you the right report. So positivity from various scientific studies are from 33 to 70% positivity. So you can imagine a very high number is being missed if you rely totally on the ultrasound. Okay. So similarly, the blood test. Blood tests, there are a whole lot of tests, but the important ones are FSH, which comes from the pituitary, follicular stimulating hormone, and LH, luteinizing hormone. Those sitting here watching who have PCOS will realize that in this, normally the FSH is high, LH is low. In this, it reverses. The LH is high and the FSH is low. It reverses. Then the other test we do is serum testosterone, especially if you've got hair or acne, and we look. So testosterone, it gives us a hint if a person has got, these masculizing features. Now, in those conditions, you have to give a medicine which is called spironolactone. Now that Dr. Saab will discuss later because I don't want to get into the management, but this is how we differentiate what it is. Again, you may not have blood test positive. You may only have clinical features, or you may not have blood test positive. You may not have clinical features. You may have ultrasound. So the WHO has come up with a simple definition. It is a clinico-pathological radiological diagnosis. which means it could be clinical, it could be pathological, means biochemistry, or blood test, or it could be radiological. So look at all three. Look at all three. Don't go by just one. Then, of course, we look at HbA1c. We do a OGTT with 75 grams of glucose for insulin resistance to tell. We look at ultrasound if there is a fatty liver there. So all these give us an indication. Then there is another interesting PCOS called thin PCOS, which in that you will get the DHEA as high, right? The DHEA comes high. That's the kind of hormone which is secreted by the adrenals. So the adrenals start secreting androgens, and those is a younger age group, and they're a thinner age group. So so this is what you have to individualize the whole thing and see which group you're fitting into, and then you have to treat that accordingly. So that's how we do it. But VLCC, I'll tell you one thing. VLCC has been giving fantastic results. Our R&D has got the entire data. The reason is because it is not only diagnosis, it's the treatment which Dr. Saab will just be coming to. You have to have a whole team. So here we have the dietitians who take care of the high insulin part, and the other part, the hormonal imbalance. Then you have the doctors who are going to decide on what medical treatment has to be given. And then you have the fitness people, and you're leading the team, Dr. Anju. You're probably the best in Delhi for fitness. So that's another great team. And then you have the counselors. So you have excellent counselors also who are going to tell you how to go about it. So that is the reason why we are getting such good results. You cannot just come to Dr. Bhatia and say, "Mujhe PS," or a gynecologist and say, "I have PCOS, treat me." I'm going to be a loser then. It's not going to work that way. It has to be the team. And that way, I think VLCC has put up a very good team, undoubtedly.
Absolutely, Dr. Bhatia. And thank you so much, Dr. Bhatia, for your detailed explanation. And I'm
You're
sure
welcome.
it's going to help so many of our attending ladies. And thank you for your time today.
Thank you. Thank you so much. Thank you.
So now we know we have PCOS with the diagnosis that Dr. Bhatia just explained. And so what is the treatment? That's our next question. And I can see that coming up from all of you. So let me invite Dr. Meeta Sharma, our next panelist, who will help us with this. Dr. Meeta Sharma is a senior gynecologist and obstetrician attached with Max, Apollo, and various other hospitals. She has over 25 years of experience, and recently she has been voted the best gynecologist, obstetrician, and laparoscopy surgeon in South Delhi. Congratulations, doctor. And she specializes in high-risk pregnancies and has been treating PCOS and infertility in women of all ages. Dr. Meeta, welcome to this webinar, and thank you so much for helping us with your time and knowledge.
Yeah, thank you. Thank you, Dr. Anju, for your kind introduction. And good morning, everybody, and a very Shubh Vijaya today. Coming to the treatment of PCOS, the treatment of PCOS is as complicated as the disease itself. Now, in treatment, we target the patient's concern and the sign and symptoms with which the patient is presenting. So actually, the treatment is individualized. Usually, the domains which require treatment are irregular periods, infertility, hirsutism, or hair at the wrong places, and loss of scalp hair, and acne or pimple. So these are the domains which are targeted. Now, each of these should be assessed at regular intervals so that none of them are missed out. Now, when we particular treatment which is given in PCOS are medication, lifestyle modification, and lastly, surgery. In medication, first of all, hormones are given because actually this is a hormonal disorder. So we give oral contraceptive pills or progesterone depending on the complaints of the patient. These oral contraceptive pills, they also reduce weight. Now, this is a big concern that, doctor, if I start OCPs, I will gain weight. So usually now the pills which are available, they are low dose pills, and usually there is not much weight gain. Now, in fact, they reduce the androgen levels. So they also help in hirsutism.
Wonderful.
And in fact, they prevent endometrial carcinoma, development of cancer of the uterus at later stages. Then after oral contraceptive comes hormonal, which we target insulin. Like Dr. Bhatia said that in PCOS, the levels of insulin are high in the body. The body is not sensitive to insulin. So now we have to give insulin sensitizers. The most common insulin sensitizer which is used is metformin. Metformin also helps in reduction of weight. And in fact, metformin gives very good result in infertility with the ovulation induction agents. Now, people or patients who desire pregnancy, for them we give ovulation induction drugs along with metformin, and it does give good results. Then patients who suffer from hirsutism, they, apart from the usual treatment which they take, like laser and all, if the testosterone or androgen levels are high, then in that case, anti-androgens have to be given. If the lipid profile is deranged, then statins are added. Now, there are certain agents which are given empirically that they are supposed to help in PCOS. These are like inositol and chiroinositol, which is supposed to regularize or the metabolism of the ovary. And similarly, zinc, magnesium, and vitamin D, they are known to help people with PCOD.
Wonderful.
So this is about the medication part. Then coming to the lifestyle modification. So the pillar is weight loss and dietary control. That is, what we advise is a low carbohydrate diet. Of course, I think they will take over that. Now this, I would say the lifestyle modification, this has to be the lifelong mantra. Because even if the PCOD is treated, okay, now right now the patient doesn't have any sign or symptom or any complaint of PCOD, she's fine now. But if she digresses from her lifestyle modification, then PCOD will come back. So yes, lifestyle modifications are very important. In case there are certain patients who are resistant to medicines or nothing is working, in that case, we do a laparoscopic ovarian drilling, in which a laparoscope is introduced and we make 2-3 holes in the ovaries. And that leads to release of the testosterone, and it does give good results. So yeah, this is
wonderful. Thank you so much, Dr. Meeta. And so what you have shared with us, Dr. Meeta, is that treatment depends on the symptoms and severity, and it includes medicinal, lifestyle changes, and as a last resort, surgical interventions. Yeah. Right? So certainly. The idea is to control the symptoms, and once done, we need to maintain it. So no matter what the course of treatment, reducing weight will always benefit, right? Yes. So let's go forward.
Maintenance of a healthy weight.
Absolutely, absolutely. There are certain cases, what happens if someone leaves the treatment halfway or does not like to take it seriously? What would happen if they don't do that?
See, first of all, as I said, PCOS can be the root cause of certain concerns of the patient, like hirsutism or maybe acne. And if she's taking treatment for that, and maybe she's getting the result, but as soon as she leaves the treatment and the underlying cause, that is PCOD, is not treated, okay, all these symptoms will come back. So for the desired results, PCOD needs to be treated. It's not that I just want a laser treatment for my hair reduction. No, if she doesn't take the treatment of PCOD, hair would come back. Yes. So, so PCOD needs to be controlled for that. Now, actually, what happens is that these are the presenting symptoms, but there are many things which are going on at the back in PCOS, because basically it is a metabolic disorder, and maybe these metabolic disorders will come in front if they aggravate. So control of PCOS is required so that later on the patient doesn't develop complications like diabetes mellitus or cardiac complications, even heart strokes. Then she might develop endometrial carcinoma or cancer of the uterus or cancer of the ovary. So in order that these are avoided, a continuous management and control of PCOS is essential. And yes, a word that PCOS needs to be normalized also for a healthy pregnancy. So it cannot be taken lightly.
Absolutely, absolutely, totally agree with you, Dr. Meeta. So what you have said is that women with PCOS are more likely to develop many of the problems associated with weight gain and insulin resistance, like diabetes, high blood pressure, high cholesterol, fatty liver, abnormal uterine bleeding, miscarriage, infertility, even sleep apnea, I have heard, and even, like you said, endometrial cancer. So many of these conditions lead to heart disease and stroke, like you said. So managing PCOS means we avoid all the above. So please follow Dr. Meeta's advice seriously if you're fighting PCOS. And thank you so much, Dr. Meeta, for guiding us. It was such a pleasure. Thank you so much. And as Dr. Meeta has advised us, while medication is generally necessary, lifestyle changes are perhaps even more critical in managing PCOS. Managing weight through diet and exercise is always necessary. So let's start with diet. To help us understand, I'm pleased to now introduce our third panelist, Dr. Deepti Verma, who with over 25 years in the field of nutrition and dietetics, currently heads nutrition at VLCC's education business. She has been a lecturer, a nutrition therapist, wellness coach, writer, and editor, and she has been a guest speaker at several conferences, national and international, and she has been recently awarded, or maybe in 2019, with the Lifetime Achievement Award in the field of dietetics and nutrition. So welcome to today's webinar, Dr. Deepti. Such a pleasure having you with us today. So the question...
Thank you so much, Dr. Anju. It is always a pleasure to be here every 15th.
Pleasure having you. And, you know, many questions coming up for you. The question most obvious is, of course, which food options would you recommend for women with PCOS?
Okay, so actually, basically, PCOS has all the associated symptoms of insulin resistance, as Dr. Bhatia and Dr. Meeta Sharma have mentioned. And other than this, it is heart diseases and weight gain. So the diet that we give in PCOS condition is actually to do with this. So the first and foremost, very important, as Dr. Bhatia has also mentioned, is to, and Dr. Meeta has mentioned, that a diet which is low on glycemic index, that is the carbohydrates. So carbohydrate actually gives a lot of insulin spikes. So fiber is also a component which is part of the carbohydrate only, but we need to slightly increase the fiber content in the diet. So the cereals that we have, so there is a term called glycemic index, which is kind of a number which is given to every food basis, how fast the glucose from that food gets absorbed into the circulatory system. So in the condition of PCOS, we have to continue giving them a diet which is low on glycemic index. And that's possible by giving the carbohydrates, especially like roti and rice, or the corn, which is makki ki roti, or bajra, jawar, or any other millets, and have lots of salads and vegetables with the main course. So that further, actually having the fiber with the diet actually lowers the glycemic index of the total food, and thereby controlling all these three conditions, that is insulin resistance, heart diseases, and unnecessary weight gain. So hence, that is the kind of diet to give the foods which are low on the glycemic index by adding additional fiber to the diet. So we have to ensure that there is a solid part of every meal, more amount of vegetable, fruits to be taken intermittently, at least twice in a day, and to have the cereal not as such, but along with the vegetables in salad. So that's about the carbohydrate. And then the second very important thing to keep in mind is to give healthy fats. So when we talk about healthy fats, it's basically to do with the unsaturated fat. That's PUFA and MUFA, which is polyunsaturated and monounsaturated. By that, I mean that fats that remain liquid at a temperature of 20 degrees, like in winters. So those are the fats which are considered to be healthy. So of course, mustard oil, the other oils like sunflower oil, peanut oil can be given in the condition of PCOS. Other than that, very important is omega-3. So the sources of omega-3 have to be additionally taken because they are not really part of our regular meal. So they include walnuts or flax seeds or chia seeds or almonds. So these are additional to be given as part of the diet on a regular basis. So if we really talk about the amount, because this is a question normally that people often ask me, that how much of these nuts and seeds to be taken. So yes, 2 walnuts in a day should be enough. Other than that, about 1 fist is the amount of nuts that we give to people, to patients with PCOS. So a fistful of the nuts, dry fruits need to be taken to actually be supplied with good amount of omega-3. That will take care of, because, the healthy fats have so much to do also with infertility and with unnecessary weight gain. So hence it becomes important, and omega-3 is anti-inflammatory. So that would definitely help in weight loss as well. Now, the third thing, which is very important to be considered and taken as part of the diet, is calcium and vitamin D. So I always see that, most of the Indian population is suffering from a low vitamin D levels. So in case the vitamin D are exceptionally low, one may need the supplementation, for which please get in touch with your doctor and have it optimized, because it's important to have correct levels of vitamin D in the body, because vitamin D is also responsible for ovulation, which is a problem in PCOS, and it has so much to do with weight loss as well. So hence, and of course, like vitamin D also controls the calcium absorption. So the calcium is directly responsible for the follicle development and the egg maturation in the ovaries, which is a problem in PCOS. So hence, calcium and vitamin D especially need to be taken care of. So when we talk about the calcium supplements, so they are green leafy vegetables, cereals, nuts, sesame seeds are very rich. Ragi as a cereal is very, very rich in calcium. Contains almost 2.5 to 3 times more calcium compared to even milk for that matter. So this is about the calcium and vitamin D3. And now when we talk about the fourth food, so which is chromium as a mineral. So chromium as a mineral is particularly important when we talk about a diet in PCOS, because chromium is responsible for, it helps manage insulin resistance. So which is actually becomes the key and is also responsible for the good ovarian health. So when we talk about the chromium, the major foods that comes, they are supplied with comes from the whole grains, and all the things which are made from the whole grains. Onion, the raw onion that is good in chromium, and broccoli, lettuce, tomatoes. So these are the foods which are quite rich in chromium. So they also need to be taken. So these are primarily the foods that I would suggest, one need to take when they're actually, and chromium, I guess, of course, it's also responsible. It's a component of the GTF, which is glucose tolerant factor that regulates the blood serum or serum glucose levels. So
Wonderful.
Hence, these are primarily the foods I would say are responsible for it.
Thank you so much, Dr. Deepti. And so, yes, eating foods high in fiber, like she said, causes a slower and more controlled rise in blood sugar and insulin levels. And of course, apart from all the healthy tips that she's given, women with PCOS sometimes lack micronutrients and vitamins. So along with the food choices she suggested, make sure that you can take a good multivitamin and mineral supplement if required, containing vitamins, fat soluble vitamins like A, D, E, and even C, and B complex, B6, B12, folic acid, and the minerals like magnesium, iron, zinc, especially chromium, like she said, selenium and manganese. Okay, so let's go forward from here. Dr. Deepti, final question for you. Are there any foods to avoid that would help in better managing the PCOS?
Oh, yes, there are. I mean, there's been so much talk of the town about the milk intake and PCOS correlation. So yes, I mean, dairy, something I kind of cut down, so there have been many researches which have said that when you actually bring down the dairy intake in women with PCOS, it definitely, controls and optimizes the side effects. So majorly because, cows these days are drugged with a hormone called oxytocin to actually increase production of the milk. And that oxytocin from the milk gets into our bodies and from our intestines, are absorbed into our bloodstream, creating havoc and hormonal disturbances and elevates androgens. So hence we need to actually bring down the dairy intake for sure. And that's number one. And second is the processed foods and the sugar. So when we talk about the processed food, anything which is coming from the market is something that we would, like in terms of the packaged foods, we would not wish to give. The third thing is anything which is made with a refined flour or maida. So all the biscuits and bakeries and, all the samosas and pizzas and burgers are the things that one kind of really bring down and or have them with some vegetables and fiber in case you need to have them at all. And and of course, fourth is caffeine. So we need to bring down the caffeine. Absolutely. Because it actually is with all the symptoms of PCOS. And smoking and alcohol. Smoking especially, we need to stop totally because smoking gives rise to further insulin resistance, which is already prevalent in women with PCOS. So these are the foods that we would not wish to give to a woman with PCOS.
Thank you, Dr. Deepti, for your wonderful guidance. Yes, indeed, processed food is a no-no as far as possible. In fact, when buying food, it's really important also to read food labels carefully to identify hidden sugars. So if sugar or any ingredients like brown sugar, corn syrup, or corn-based sweetener, anything ending with O's like glucose, sucrose, dextrose, fructose, or high fructose corn syrup, even honey for that matter, invert sugar, malt sugar or molasses are listed as one of the first 3 ingredients on any label, any ingredient list on the label. The food item is high in sugar and should be avoided as far as possible. So thank you so much, Dr. Deepti, for joining us and sharing your experience with us. It was lovely. So let me now take up the last part of lifestyle change in managing PCOS, that is exercise and staying active and stress-free. So question from you all is, how does exercise help us manage PCOS? So exercise brings down the insulin levels and also helps us with weight loss. So it's a double benefit, which multiplies and it benefits everyone, not just against PCOS. So women with PCOS find it a constant struggle to lose weight. But, as it has been said, it is doable. And if you have PCOS, shedding just 10% of your body weight can bring your periods back to normal. It can also help relieve some of the symptoms of the syndrome. So weight loss also improves insulin sensitivity, and that reduces your risk for diabetes, heart disease, and so many other PCOS complications like Dr. Bhatia and Dr. Meeta have already mentioned. So do what you can do to get your weight under control. And it may not be easy, but it may be well worth the effort and commitment. And of course, we at VLCC are always there to help you. Exercise can be especially helpful in lowering insulin levels after a meal. So whenever possible, take a short brisk walk after you eat a meal before getting back to your routine. And of course, you all know, apart from weight loss, exercise decreases your blood pressure, it lowers your glucose levels, it raises the good cholesterol and decreases the bad triglycerides. It also increases your muscle mass and energy levels. And of course, it's going to help you manage your stress, right? So many benefits of doing exercise and managing PCOS. Now, of course, the next question is, which exercise or which exercises would help in managing PCOS? So here goes the answer. Since reducing insulin levels in the blood is so critical in treatment of PCOS, which happens whenever you exercise, so we could do, the following exercise. First is moderate intensity aerobic exercise for an hour a day is ideal. So this 1 hour, you would say, I don't have so much of time, and how could I do 1 hour a day continuously? So that's you can, do 1 hour, and you can split it across 2 to 3 sessions in a day. And it could include brisk walking, jogging, cycling, swimming, skipping if you're not too very much overweight, treadmill, cross trainer, even dancing and playing sports, etc. So anything to get our hearts beating faster. Of course, one has to be well hydrated. And the second thing is adding muscle. And because, muscle helps burn more calories. So when we exercise and if we build muscle, that's going to really help us lose weight. So add 15 minutes of resistance training, also known as strength training, to build muscle mass. And you may, sort of exercise machines in a gym if you're going to a gym, or free weights like dumbbells, resistance bands. Or if you're not a weight person, you can just use your own body as resistance and do crunches, lunges, squats, planks, arms and leg strengthening exercises. In fact, yoga and Tai Chi, though very gentle, also fall in this group. So you just need to do 15 minutes of this every day, either at one go or in breaks, or probably if you want to do it, say 30 minutes twice or thrice in a week is also good enough. The thing is that one has to avoid being sedentary. Take breaks from sitting, move and walk as much as possible. Being sedentary and sitting too much is linked to an increased risk of obesity, PCOS, heart disease, diabetes, and even some types of cancer. So never lose an opportunity to get up and walk whenever you can. And the best thing is, invite family and friends to join you, to help you and keep you motivated. Use variety of exercises to keep up your interest. Make exercise a regular part of your healthy lifestyle, and try to exercise maybe at the same time of the day so it becomes a real habit with you, because we need to maintain our weight. Like Dr. Meeta said, it's a lifelong commitment, right? So I would like to leave you with a very positive message that PCOS, though made out to be so difficult, is actually controllable. Seek expert help to understand what's best for you, and please take it seriously. Losing weight is always a good first step, and keeping it off is the next. So medical treatment is always there to help you manage your symptoms. And of course, stress worsens the problem. So don't let it creep into your life. As best as you can, fill your life with friendship, with family, pets, laughter and love. And real relationships are the best support for lifelong healthy life. And finally, keep smiling, because feel good about yourself. And definitely you are special. So at VLCC, our focus is of combined benefit It's like, we are managing the diet, the activity and lifestyle to keep all our clients healthy and well for life. And that's why a team of doctors, physiotherapists, nutritionists, therapists, and wellness counselors, they all work together on custom design regime for each and every client to help them achieve their wellness goals. Even PCOS, like Dr. Bhatia said, we have had wonderful results with PCOS cases. And it's not just about weight loss or the body shaping. So thank you all for attending our webinar and guiding our conversations with your wonderful questions. And thank you also to our panelists, Dr. Bhatia, Dr. Meeta, Dr. Deepti, for all the learnings today. And we really hope you now have the confidence of PCOS if you have it. And if you wish to know more, there is a VLCC center near you where a team of experts is waiting just for you. So wish you all a healthy life filled with happiness and fulfillment. And good day to you and goodbye. Thank you so much. Bye.